Sajid Javid.
Mr. Speaker, with permission, I'd like to make a statement on a new ambitious elective recovery plan, the NHS's delivery plan for tackling the COVID-19 backlog of elective care. The NHS has responded with distinction during the country's fight against the virus, caring for over 700,000 people with COVID-19 in hospital in the UK, and delivering a vaccination programme that's helping this country to live with the virus, while at the same time doing so much to keep non-COVID care going. Nobody, no institution, felt the burden of the pandemic more than the NHS. There have been 17 million cases of COVID-19, and the NHS has had to respond to the original variant, the Alpha wave, the Delta wave, and most recently, of course, the Omicron wave. But even in spite of these pressures, we had one of the fastest vaccination programs in the world, and that includes the fastest booster program, one of them in the world. Sadly, as a result of focusing on urgent care, the NHS couldn't deal with non-urgent care as much as anyone would have liked. The British people, of course, have understood this. Despite these exceptional efforts, there is now a considerable COVID backlog of elective care. 1,600 people have waited longer than a year for care before the pandemic. The latest data shows that this figure is now over 300,000. On top of this, the number of people waiting for elective care in England now stands at 6 million. That is up from 4.4 million before the pandemic. Sadly, Mr. Speaker, this number will continue rising before it falls. A lot of people, understandably, stayed away from the NHS during the heights of the pandemic, and the most up-to-date estimate from the NHS is that that number is around 10 million people. But I want these people to know that the NHS is open, and as Health Secretary, I want them to come forward for the care they need. We don't know how many will now come forward. We don't know whether it will be 30% or 80%, because no country has faced a situation like this ever before. So, in developing this plan, the NHS has had to make a number of assumptions. Even if half of these people come forward, this is going to place huge demand on the NHS, and we are pulling out all the stops so that the NHS is there for them when they do. We have already announced that we're back in the NHS with an extra £2 billion of funding for elective recovery this year and £8 billion on top of that over the next 3 years. In addition, we are putting almost an additional £6 billion towards capital investment for new beds, equipment and technology. And today we're announcing the next steps. It shows how we will help this country's health and care system to recover from the disruption of the pandemic, but also how we will make reforms that are so important for the long term. It will allow the NHS to perform at least 9 million extra tests and checks and procedures by 2025, and around 30% more elective activity each year in 3 years' time than it was doing before the pandemic. This bold and radical vision has been developed with expert input from clinical leaders and patient groups. It won't just reset the NHS to where it was before COVID, but build on what we have learnt over the past 2 years to transform elective services and make sure that they are fit for the future. Mr. Speaker, this plan focuses on 4 key areas. The first is, how will we increase capacity? On top of enormous levels of investment, we are doing everything in our power to make sure that we have even more clinicians on the front line. We now have more doctors and nurses working in the NHS than ever before. We have a record number of students at medical school and a record number of students applying to train as nurses. The plan sets out what more we will be doing, including more healthcare support workers and the recruitment and deployment of NHS reservists. We will also be making greater use of the independent sector, which formed an important part of our contingency plans for COVID-19, so we can help patients to access the services they need because of this high demand. Second, Mr. Speaker, as we look at the backlog, we will not just strive to get numbers down, but also to prioritise by clinical need and to reduce the very longest waiting lists. Assuming half of the missing demand from the pandemic returns over the next 3 years, the NHS expect the waiting list to be reducing by March 2024. Addressing long waits is critical to the recovery of elective care, and we will be actively offering longer waiting patients greater choice about their care to help bring these numbers down. The plan sets the ambition of eliminating waits of longer than a year, waits in elective care, by March 2025. Within this, no one will wait longer than 2 years by July this year, and the NHS aims to eliminate the waits of over 18 months by April 2023 and over 65 weeks by March 2024, which equates to 99% of patients waiting less than 1 year.